I am Dr. David Kalin, a medical doctor with a master's in public health and the executive director of the International Board of Medicine and Surgery, IBMS, here to discuss the mission of the International Board of Medicine and Surgery and why international certification is important. I've experienced firsthand the value of medical tourism with the birth of my 8th child, conceived in Korea through in vitro fertilization. Since 2002, from this experience, I have worked to develop the International Board of Medicine and Surgery. Within the last several years, the Joint Commission International has been accrediting hospitals throughout the world to help ensure accountability and confidence in medical care. And in order to reduce the risk for patients, has raised issues of physician selection, follow-up medical care, treatment of possible complications, and communication with the primary physician. The medical tourism industry has evolved significantly during these years, and only within the last 3 has the industry had more and more growth of International Medical Tourism Association meetings and congresses, where we have been able to meet people whom some of us have met before in our travels around the world. The absence of physicians, however, at these congresses is palpable, and the prevalence of medical tourism facilitators, insurance companies, and other people who are not the professional providers of medical care is demonstrable. The International Board of Medicine and Surgery has been one of the only physician, surgeon, or dental organizations involved in the global healthcare community, medical travel, medical tourism industry, and we hope to become the preeminent organization in this area. The International Board of Medicine and Surgery complements the Joint Commission International and other accrediting organizations by certifying physicians, surgeons, dentists, and other healthcare professionals in the global healthcare community, with review of national licensure and specialty certification. As we search for the finest healthcare providers in the world, we certify them within 5 levels of certification, from basic entry level to emerald, the highest, with gold being the mid-level standard, encompassing indemnification of potential complications. We seek to create a dynamic whereby our physicians, surgeons, and dentists will be reaching to demonstrate why they are the finest healthcare providers in the world, thereby demonstrating more credibility to the International Board of Medicine and Surgery as consumers seek additional sources to affirm a decision to go abroad for medical treatment. One of the fundamental turning points in a potential patient's decision to seek medical treatment abroad is the assurance that potential complications will be treated in a seamless, professional manner. Indemnification of complications, either through an insurance company or one's own individual financial indemnification, a physician's network, the treating hospital, another provider, or through a pre- and post-medical care treatment network for potential medical tourism complications, in addition to a pledge to communicate clearly with patient's medical professional in home country, is an essential component in creating this assurance, and has been adopted as a criteria for IBMS Gold certification. With standards and a pledge to abide by professional medical ethics, IBMS looks to expand the legitimacy of the physicians in the international global healthcare community. Over the last 5 years, the medical tourism industry and the International Board of Medicine and Surgery have evolved with a clear understanding that medical tourism travel facilitators, companies, take the responsibility of collecting and distributing patients globally. IBMS, on the other hand, is a professional medical organization working to create visibility and credibility of healthcare providers in this global environment by certifying the finest healthcare providers in the world and creating a voice for these physicians, surgeons, and dentists. IBMS affiliates with centers of healthcare excellence, hospitals, and clinics wanting to associate themselves with IBMS standards. As an affiliate, they pledge to ensure high professional standards of patient care. IBMS also affiliates with healthcare travel associates, medical tourism travel facilitators, companies connecting patients with top quality healthcare providers worldwide, medical industry professionals working to develop global healthcare infrastructure, and professional associations promoting quality healthcare standards, developing and facilitating professional medical relationships and services in the global healthcare marketplace. IBMS creates visibility and credibility for our certified and affiliated membership and offers assistance in providing the public an opportunity to become aware of these certified and affiliated members through the IBMS Professional Online Web Registry, which clearly identifies a certified member's level of certification and links to the IBMS certified or affiliated members website. IBMS also contracts with 3 independent affiliated healthcare travel internet sites, one of which is healthtravelservices.com, a highly selected name in Google search, and 2 other sites, medivacation.com and emedivacation.com, on which our certified and affiliated members are highlighted. In summary, IBMS seeks to foster patient safety, efficacy, confidence, transparency, and an increase in the global acceptance of our certified physicians, surgeons, and dentists. IBMS is searching for the finest healthcare providers in the world. IBMS is concerned with how global healthcare providers attend to emergencies, complications, and infection control, and is working to provide assurance to the public, thereby creating visibility and credibility for our certified membership. IBMS is one of the few medical-related organizations dedicated strictly to the healthcare professional working in the global healthcare marketplace. IBMS, being a physician-advised organization, knows and works with physicians, surgeons, and dentists, the healthcare providers in the engine called the global healthcare community. IBMS has a vision for the future, which includes an international congress with concurrent development of an international medical journal, dealing with issues specifically related to areas of medical travel and tourism, such as cross-country infections, pre- and post-medical complications, professional transfer of patient information, cultural interrelationships, translation, and other essentials facilitating communication and the development of a doctor-patient relationship. These goals are unique to the International Board of Medicine and Surgery and are distinct from various other professional colleges, associations, or academies which may be focused on a specific medical specialty. IBMS, recognizing jurisdictional boundaries, is continually creating international relationships and working through the IBMS Medical Advisory Board to bridge the certification process globally. With the support of leaders in the medical tourism industry, the International Board of Medicine and Surgery, IBMS, is working to create an environment of transparency and legitimacy, protect patient safety, and enhance professional integrity in the global healthcare marketplace. IBMS looks forward to your participation in this bright future and is excited about working to meet the needs of creating professional visibility and credibility and enabling the public to make informed decisions in the international global healthcare marketplace. Please tell your colleagues about IBMS certification with online registration and take time to review the IBMS internet site www.ibms.us.